and you're just going to get onto the first rib. I would side bend away first and just make sure that you're not like putting a lot of pressure on the brachial plexus. So I like to take my hands and get like under like the middle scalene, but not like be right on in between that space between the anterior and middle. You'll feel a pulse under your thumb like I do right now. So not a good area to push through. So then I'll come lower on that part of the rib. Now what I can do is I can flex, I can ipsilaterally side bend and contralaterally rotate. And I can just hold it there in a shortened position. I can have him take a couple breaths in and out, and I can see if the rib is moving appropriately, and I can glide it actually as well.
So you're on the rib?
I'm on the rib, and it's in a shortened position. I'm encouraging that pump handle motion. But right now, when you're doing it, just with it in a shortened position, you can just glide it anterior and inferior a little bit. Remember, it does a pump handle motion, so the glide would be in that direction. When you hold it there for about 90 seconds, sometimes you might even feel a little click or something like that because that rib is fixated a lot under a lot of load with the drag of the shoulders, forward head posture, etc. And then people ending up breathing through it. Then what we'll do is we'll ipsilaterally rotate, contralaterally side bend and flex. And do you feel a pull?
A little bit. Mm-hmm.
Yeah, right there. So there, I can put a decent stretch on the scalenes. You hold it for 20 or 30 seconds, you check the mobility, and eventually what we'll do is if you're in a shortened position and then the patient is not moving, we'll show you a couple different ways where we can manipulate the first rib in supine.